Hello, welcome back to my new video about laboratory tests that require a special diet before you taking. If you want to give accurate result from your laboratory test, you have to observe some conditions. One of them is fasting that I told in previous post. And for some laboratory tests, you have to follow a special diet in a certain of time before you taking. Follow me for some them. Triglycerides. The patient should have been on a regular diet for 3 weeks and should not have consumed alcohol for three days before sampling and should not have done heavy exercise for at least 24 hours. HDL and LDL, that known as a good cholesterol and bad cholesterol, are performed to identify persons at risk for developing heart disease. For best result, the patient should have a consistent diet and constant body weight for 3 weeks. Smoking and alcohol ingestion decrease HDL levels. PT and PTT. Prothrombin time or PT test is for external pathway and partial thromboplastin time or PTT test is used for internal coagulation pathway. Although heparin prolongs PTT, it can also prolong PT to a lesser extent. If the patient is receiving heparin by intermittent injection, plan to draw the blood specimen for the PTT is 30 to 60 minutes before the next dose of heparin. Sample for coagulation test should not be taken from the arm injected with heparin, herodine, or argatroban. Bleeding time. This test can identify abnormalities in the ability of platelet to aggregate or instigate the hemostatic cascade. The patient should to ban from taking aspirin or similar medications during the week before the test. Serum ferritin. This serum ferritin study is a good indicator for available iron stores in the body. Serum ferritin determination will not very reliable when the patient is being treated with iron therapy. Platelet aggregation. This test is a measure of platelet function and aids in the evaluation of bleeding disorders. The patient should not have taken aspirin for 7 days before the test and should also avoid taking non-steroidal anti-inflammatory drugs or other platelet-lowering agent. Phenylalanine. Phenylalanine is used to identify hereditary phenylketonuria in infants. Infants should be well nourished with milk for at least 48 hours before the test. Stool fecal fat. This qualitative or quantitative test is requested to diagnose gastrointestinal disease and problem with fat absorption. An adult should be on a diet containing about 100 to 150 grams of fat per day for about a week before and during the test, and avoid high fiber foods for a few days before the test. The patient should not have consumed bismuth, castor oil, or mineral oil for a week and should not have used any substitutes before collecting the sample. Stool pH. It is performed to evaluate series of food intake problems inflammatory and intestinal cancers. Diagnosis procedure with barium and laxative should not be performed until 1 week in advance. Schilling test or cobalamin test. Uh, this test is to determine how well a patient is able to absorb B12 vitamin from their intestinal tract. The patient should not have received B vitamins group for 3 days before the test. Protein C and protein S. Protein C and S are glycoproteins that are important component of the natural anticoagulant system in the body. Pregnancy or use of exogenous sex hormones is associated with decreases in protein C and S. Warfarin also reduces the level of these proteins. Protoporphyrin or free erythrocyte is a hemoglobin precursor that is increased in iron deficiency, lead toxicity, and erythropoietic porphyria. The patient should not have consumed alcohol in the last 24 hours, and it is proposed not to have taken any medication in the past week. Urine or plasma metanephrine. This test is superior to all other methods for diagnosis and excluding pheochromocytoma. All food containing methylxanthine should not be eaten for 24 hours. Homovanillic acid. It is used to find neuroblastoma and pheochromocytoma, follow up treatment of patients, and screen newborn with a catechol metabolism disorder. The patient should not have taken aspirin, disulfiram, reserpine, or pyridoxine as much as 48 hours before collecting the sample. Levodopa should not have been used until 2 weeks ago. Urine 5-HIAA or 5-hydroxyindole acetic acid is a breakdown product of serotonin hormone. Bananas, plantain, pineapple, kiwi, walnut, plum, pecan, and avocados can artificially have elevated 5-HIAA levels. Drugs that may cause increased 5-HIAA levels include acetanilide, acetophenadine, glycerol glycolate, methocarbamol, acetaminophen, and reserpine. And also drugs that may cause decreased levels include aspirin, chlorpromazine, ethyl alcohol, heparin, imipramine, isoniazid, levodopa, methenamine, methyl-dopa, monoamine oxidase inhibitors, phenothiazine, promethazine, and tricyclic antidepressants. These foods and drugs should not be consumed for at least 2 to 3 days before sampling and during sample collection. Urine hydroxyproline. Hydroxyproline is a product of collagen breakdown. The patient should be prohibited from consuming foods containing gelatin and meat and aspirin containing medication at least 24 hours before and during urine collection. Thank you for your watching. If you have not subscribed to me yet, please do it from below link. Have a good time. Take care of your health.